A very good afternoon to one and all present. It gives me immense pleasure today to present at the Bombay Psychiatric Society Clinical Meet in front of distinguished dignitaries and colleagues. We have seen so far various cases of patients with varied presentations and also how we have treated them with naltrexone. We also saw the various mechanism of actions by how naltrexone blocks the mu receptors and its action on the GABA interneuron in the ventral tegmental area and other mechanisms of action in the human brain. So now we would dwell into the review of literature regarding the use of naltrexone in impulsivity. First, we would like to have a look at the role of naltrexone in compulsive sexual behavior disorder. A study was done on 19 patients who were diagnosed with CSBD who were already on psychotropic medications. It was found that 17 out of the 19 patients reported reduction in CSBD symptoms after taking naltrexone between a time period of 2 months to 2.3 years. Thus, it was concluded through the study that naltrexone is a useful adjunct in the treatment of CSBD. A 20-week randomized clinical trial was also done comparing the efficacy of paroxetine and naltrexone in the treatment of CSBD. It was concluded through the study that naltrexone is indeed efficacious for the treatment of CSBD, and it was also shown that there was reduction in symptoms and there was complete cessation of symptoms for a period of 30 days at week 8 in 65% of patients. Also, individual case reports testify the fact that naltrexone at a dose of 50 to 100 mg per day is very useful in the treatment of CSBD. A randomized control trial is also currently underway comparing the efficacy between fluoxetine and naltrexone, and the results are awaited and we shall await them very eagerly soon. Moving on to the role of naltrexone in autism spectrum disorders. So like Dr. Asit Biswas sir spoke a while back, there was a staggering amount of prevalence of self-injurious behavior in developmental disorders. So it needs to be managed, and one of the treatment options is what we are discussing right now. So in terms of naltrexone in ASD, a systemic review was done regarding the same. Out of 155 children across 10 studies, it was seen that 77% of them had improvement in the symptoms of hyperactivity and irritability. Also, it was concluded that it can be used in the treatment of hyperactivity and restlessness. However, right now there is very less evidence to suggest that it has an effect on the core features of autism spectrum disorders as right now. Open trial on 2 girls diagnosed with ASD with serious self-injurious behavior was done who were treated with naltrexone, and it was seen that there was reduction in the self-injurious behavior along with improvement in hyperactivity and attention as well at a dose of 1 mg per kg per day. Similar doses of around 0.5 to 2 mg per kg per day has been shown to be efficacious across the findings through various case series. Individual case reports also testify the fact that naltrexone is useful in the attenuation of symptoms of hyperactivity, aggressiveness, irritability, temper tantrums, social withdrawal, and stereotypical movements. And finally, we come to the role of naltrexone in non-suicidal self-injury, NSSI. So again, over here, a systemic review was done regarding the management, and it was found that a combination of pharmacological agents like naltrexone along with structured psychotherapeutic approaches is very effective in 75% of the patients. Various case series have also testified the fact that a dose of 25 to 50 mg per day is effective for the management of NSSI. Drake et al. Reported a case of a 39-year-old Caucasian male who was diagnosed with severe recurrent self-injurious behavior with dysthymia, was successfully treated with naltrexone. It was seen that there was an impressive cessation of symptoms after the use of naltrexone, which was maintained through the 32-week period follow-up. With that, I conclude my presentation. Ladies and gentlemen, thank you for your attention.